Welcome to The Holistic Nurse with your host, Peggy Smith. Peggy will introduce and educate her viewers about the differences between alternative, holistic, and complementary medical therapies. Her goal is to empower the lay medical consumer to learn how to advocate for themselves. So now, please welcome the host of The Holistic Nurse, Peggy Smith.
Hello. Have you ever been told that your lab work at the doctor's office is normal, but you know you don't feel normal? Or have you ever just felt dismissed, like nobody's listening to you in the doctor's office? And have you ever just kind of doubted your own body and thought the professionals must know what they're talking about? Hi, everybody. I'm the holistic nurse with Peggy Smith. I am Peggy Smith, a nurse with 45 years clinical and holistic experience. And today we're going to talk about something that sometimes is uncomfortable uh, because, the average patient kind of usually assumes the doctor knows 100% more than they do. And I'm going to be sharing it from a nurse's perspective. This is an incredibly important topic. It's medical gaslighting from a nurse's perspective. So if this is something you resonate with, please share it with everybody because if it feels right for you, I'm sure everybody else has similar experiences. But those three questions I mentioned, you've been told normal lab work, normal testing, and you know you just don't feel right. Uh, you leave the doctor's office sometimes thinking that the doctor didn't hear you, nobody's listening. You feel slighted because he gave you the nurse practitioner or the physician's assistant, which, by the way, is actually a gift from the doctor. They're allowed to talk to you a lot longer than a doctor is. And you leave the place doubting your own body because a professional told you that there's nothing wrong with you. We all have Aunt Mary, who always complains at the family dinners, all the medical problems she has, and everybody says, "Oh, she's my hypochondriac aunt, and God forbid I don't want to ever have anybody talk about me like that." But we're going to talk about what medical gaslighting really is today. And basically, it's when a patient's symptoms or concerns or lived experiences from the patient's perspective feel like the doctor is just too busy to listen, minimizes the symptoms. Say, "Oh, you're too young to be thinking that. Dr. Google's you shouldn't be going there. All your tests are fine." And it's something that we've all felt many times. But I want to make it clear, healthcare professionals are not typically and really not basically malicious of heart. That they wouldn't be in this field if they were. God knows we're not in this field to make lots of money because it's just not there anymore, if it ever was. But they're practicing in a system that is overwhelmed. They feel rushed, um, and and they're just trying to meet all the reimbursement guidelines so that they can get paid the little bit of money that insurance companies want to give them. My own family doctor, who, typically when I go, if I'm in the waiting room longer than I would like to be, I don't feel like that's a problem for me because I know that she'll spend the same amount of time with me if I need it that she's spending with the patient before me. But she has told me that she actually gets penalized if she spends more than X amount of minutes for different types of diagnoses. Um, but the impact to the patient really is real. You're not imagining this. Gaslighting in medicine can sound like it's just stress. Well, we all have stress. We don't all have medical problems. You're probably just anxious. Your labs are normal. You're too young for this. It's common for women, especially with women. It's probably hormonal. And you just need to lose weight. We can all say that we've heard those many times. And there's always some truth to all of those things, perhaps, but that doesn't mean that you're not experiencing something real. And even if it is anxiety based, it's still a real feeling. It's something that can be helped. But when they're used to prematurely closing the case, and that's when harm could happen. Um, we've talked on previous shows how when it comes right down to the end game, you are the one that's totally responsible for your health care. You go to the professionals, of course, for guidance. If something doesn't resonate with you, it's okay to look for it's harder to get second opinions, unfortunately, with insurance right now. But you were certainly entitled to that. You were certainly entitled to answers. And in the holistic world, we're always talking about following your gut, listening to your gut, ask inside, what do I need? What is wrong with me? And if you can quiet and mute out all the external noise, you often get an answer to tell you where to go to seek further help. So when it happens, most doctors are only really allowed 10 to 15-minute visits. Um, so be grateful, but they're also trained to zero in, like when I worked in the emergency room and I'm triaging a patient, I, I had training to zero in on all the words, all the things the patient wasn't telling me. They might come in with X symptoms, and if it wasn't a critical care emergency situation, uh, I knew how to ask questions that were going to get me answers that they didn't know they were telling me. And most of us have had that same training. We're also all aware, unfortunately, of the insurance limitations. Um, I've had my own lab work come sometimes just be crazy normal, and there's always a possibility. It doesn't happen all, it happens rarely. There are occasions that the doctor might be looking at someone else's lab work. Um, there are a lot of people involved in the total picture. It's not impossible that your blood could be misplaced and you're looking at someone else's results. And there's a lot of bias, gender, race, age, and weight. I had one young man, was obvious to me because of my experience of having been a special ed teacher before nursing, that this man had a neurological problem. Um, Turned out he had cerebral palsy and, was really managing pretty well as an adult. I went to the hospitalist who's managing. He tells me that, do a drug screen and he's probably just a drunk. Had fallen outside. And I had to really fight, say, no, this is not, I'll do the test you want, but this is what's wrong with the patient. And eventually the doctor, it wasn't a good night that night on that shift. We were busy, but the doctor eventually apologized and to both the man and myself, for rushing to judgment so hastily. But normal labs do not always show optimal health. Some markers just aren't on the most common tests that are done. Um, the symptoms are a big part of the picture. The patient's narratives, pain is considered the fifth vital sign. But if you go to an ER on a busy Friday night and you're complaining of pain, and the computer says that you've also complained of pain many other previous visits, you may have a practitioner who's going to jump to conclusions, think that you're just seeking pain meds and there's nothing wrong with you. Uh, Pain is considered the fifth vital sign. You have your temperature, your blood pressure, your pulse, your respirations, and pain is subjective. Yes, your blood pressure might be elevated if you're experiencing really intense pain. Your blood pressure could also be completely on the other side, um, depending on how your body reacts to things like that. So we try to listen to the patients. Body patterns are important information. There's a lot of nonverbal things, and I don't want anybody to be self-conscious and make sure the doctor's not reading your mind. We've told you that on previous shows, um, but we have a short time window, especially to rule out whether or not you need to be in ICU or the step down unit or just a walk-in clinic. Um, but if we ignore those, we often miss the bigger picture. Um, and we all have stories in our families where, things maybe didn't go so well because of that. So before we ever, get to this, I want to address, patient advocacy. Patients is not always right, like you are at perhaps the department store, but in a different way, it is very important what you are offering. Um, and your personal experiences, maybe especially if it's a genetic problem, You know everybody in your family is a diabetic, you've never had any symptoms, but now your sugar is either sky high or, hypoglycemic, and you know you feel better if you have a snack when you start to feel this way, but this is worse than usual. Those are the kind of clues the doctor needs to hear. Um, it, it's always a challenge when you don't know your medical history. In case of adoption or just, records get lost, elderly people, sometimes they show up, they don't even have their correct birthday because the records get altered sometimes back in the 1930s or lost. But, I'm here to tell you today that it is so important that you just take a deep breath and try to stay calm. And, the doctor will listen to you. As a healthcare, we all have days that maybe aren't such good days. We come to work, thinking about everything we have to do when we leave work. But, it's okay to make sure that you feel comfortable that someone is really listening to you. And it can save money in the long run. A lot of hospitals have closed. Maybe you're at an urgent care type clinic or an ER because you don't have a new family doctor, you had no choice, or maybe with your insurance situation, you didn't have a lot of options. Um, and even there, sometimes the professionals have an attitude because they're overworked and overwhelmed that everybody's using the ER system instead of practical doctors. You know, we know it's a real issue right now. I'm not sure what the answer is. I know for non-medical professionals to just rely on AI and diagnose yourself, it may help you express what your symptoms are, but it's not going to help the doctor get to the answers, that you need to be treated safely. And the doctor doesn't have all the answers. You're just as important on the team as the doctor is. So in this show, we're going to talk about what you can do to make sure that you are being cared for properly. If you're not able to actually do that for yourself and advocate for yourself, try to have, doesn't have to be a medical family member, but at least a family member who's feeling good and alert enough that they can help you express what you're trying to tell. Because when you're in a lot of pain, it's hard to talk sometimes. Or when you get there already with a preconceived idea that no one's going to listen to you, those are real feelings. They're valid. You've got a reason to be feeling this way, but it helps if you are lucky enough to have a family member or close friend that can help you and support you emotionally while you're trying to get through the stressful situation. And, I remember once when I was like 7 and I was in a military hospital, my family was in the military. I had all kinds of symptoms at home, bad sore throat, maybe strep, who knows? I don't remember back then. But I remember when I got to the ER, I thought I was fine. I had no symptoms. And my mother back then, and we're going back a lot of years, I got home and she chastised me for faking it because I embarrassed her because when I got there, she took me because she thought I was sick and I was fine when I got there. Kids are resilient, and they know how to act sometimes when they want to fool us. They want to do something that you're not going to let them because you think they're sick. There's all kinds of reasons for it. But as an adult, and also especially if you're bringing a child to the ER and somebody's not listening to you, uh, you know, in a socially appropriate way, please insist that people hear you. Um, you know, uh, you might have to remind the doctor, but you have that right. It's your responsibility. We'll be right back after our first break, and we'll talk a little more about this. Thank you.
What if there were a super tiny device that could diagnose the brain and is smaller than a single human hair? What if you could see inside the brain to help an epilepsy patient during surgery or to help the fight against Parkinson's disease? Dr. Patricia Broderick is proud to announce the Broderick Probe, a biomedical and electronic breakthrough. Imagine a probe to help with the understanding and potential cure of brain-related diseases. To learn more, listen live to the Easy Sense radio show with host Dr. Broderick. And to help support the Broderick Foundation, please go to EasySense.com and learn how, with your help, we can fight these horrific brain disorders. That's EasySense.com to learn more and help support the Broderick Foundation. Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness: Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals.
Hi, everybody. Welcome back to Peggy Smith, the Holistic Nurse. Today we're talking about medical gaslighting, and I'm going to share with you the nurse's perspective. Over 20 years ago, I began my holistic practice, not just to provide holistic to the typical energy techniques and holistic services to clients, but to help empower people because I do still am active in the allopathic world, and I see every day what the struggles that we all go through. Even nurses, they go to the doctor because they have real symptoms, and they're afraid the doctor's going to think, oh, you've been you're catching everything, like they say in medical school. Doctors catch everything that there's the student doctors that they're learning about that semester. And that's a human nature type of thing. You can't help but want to use that. I wonder if I had this. I wonder if this is why this happened to me. That's all part of being human. But you're not alone when you feel that you're unheard of in the healthcare system. Some of it is just the pressure that insurance companies and other powers that be, I mean, the bottom line, for profit hospitals, which are one by one often closing. It's you don't get the same kind of care, and that's unfortunate, but it's a reality, because the insurance companies aren't here to help you get better, but they are here to help you get reimbursed for the services you need. And one real brief note about insurance companies: if you're ever denied for a particular treatment or service, uh, it's important that you read those bills you get in the mail that say this is not a bill, because they explain how much was paid, how much wasn't paid, and if you have the right to disagree with what they're not paying for and to appeal. Uh, they say a large percentage, almost 90% people, and back in the day, I didn't really read those bills either. This is not a bill. I don't care. I only have to look at my bills. But there were times I missed opportunities to actually appeal denials that would have covered services. Um, there's a disparity in different parts of the country. I've lived on the West Coast. I've lived in the southern states. I'm now in Northeast United States. Uh, and the availability of services, what gets reimbursed in your area is different. Um, but it's a basic principle. You always have a right. I'm not sure whether it's part of federal law or how that works, Medicare guidelines. If you're denied something and you appeal, you've got a really great, better than 80 to 90% chance of having the original decision reversed. I had one lady in South Carolina. She had a endocrinologist. She was a brittle diabetic. She had the doctor for 25 years. Insurance changed. She was told she had to go to another doctor who was actually 4 hours away from where she lived. And I was explaining to her she needed to appeal because she was homebound. There's no relatives that can drive her 4 hours for her necessary appointment. And her attitude was, well, if God wants me to get better, he'll provide the doctor I need. If not, I go to heaven sooner. And we all want to get to heaven, at the right schedule. Uh, but this is, not a reason not to. You deserve the health care. Modern medicine is here. It's worthless if people can't access it. But I don't talk about replacing your physician with holistic things instead of traditional medicine. I try to, in my practice, listen to the people, help them learn how to communicate with their traditional physicians, help them perhaps understand that it's okay if you don't agree with your doctor. You know, all doctors don't have the same perspective. Um, Now, it'd be interesting to see how much AI varies and all, but we still need humans in this business. AI is not going to replace us. But I help as a holistic practitioner, and one of the goals on this podcast is to help you prepare, organize, and learn how to advocate for yourself and for your family members. And we're all great at advocating for our children, our spouses, everybody but ourselves, because sometimes we struggle with feeling that we're worthy of that. But I can tell you, you are worthy, it is important, and it will save lives on your family and for yourself. Um, so when a patient is frequently dismissed and ignored at the doctor, neurologically, your brains actually change. Your nervous system either is hypervigilant, every little symptom, hiccup, everything you have. You're looking when you flush the toilet to see what's going down and what it looks like. You have self doubt, anxiety increases, uh, and you kind of freeze because as soon as the anxiety jumps up, you're feeling like, oh my God, he's going to think I'm crazy. No, I can't do that. It's important that we see our regular practitioners at least, once a year for sure, sometimes twice as you get older, and whenever you do have significant medical issues that require prescriptions or treatments. Um, Obviously, cancer has a better outcome if you participate in the early screenings. We do have, that information available. In fact, I think we'll be doing a show on exactly, the cancer screenings and what to do. And then, nobody, it's common for women that they don't often check their breasts, every time they go in the shower. I can admit I'm a woman. I don't always do it personally. And then you going to the doctors and you're embarrassed because she says, "Well, you're checking yourself every day, and well, you're just lucky you got a chance to get a shower and run off to work, catch the bus before you have to leave." Um, but when you know you have appointments coming up, or even if they're a couple months apart, it's a good idea not necessarily to have a journal, but if you have issues that you're concerned about, no matter how minor they are, you should actually just keep a running list, put it on your refrigerator, on your phone under the notepad, so that when you do get to the doctor and anxiety and panic kicks in, you can go to your notepad and you don't forget to ask, all the questions that you were worried about. Uh, I remember years ago, my doctor said, "Why are your hands always swollen?" And my answer just off the cuff was, "Well, gee, it's been that way since my hysterectomy." And, she made me laugh. She says, "Your hands aren't related to your hysterectomy." And I thought, oh, I sounded stupid, but she was right. And it turns out it was a kidney stone problem. So a doctor will see those subtle changes. And you're fortunate enough to have the same practitioner over a period of time, then she can see what's not normal for you, he or she. So when you have an appointment, go there prepared. Act like it's an appointment you would have for a business meeting, at your job. Because this is just another job we all have. And sometimes taking care of ourselves feels like a full time job. Medical trauma is real. The psychological feelings are real. Uh, and if the patient already has a chronic illness, and, so many of us have autoimmune issues in today's environment, inflammatory conditions. Our diets cause inflammation, stress causes inflammation. Inflammation and stress is one of the biggest causes of cancer and autoimmune diseases. It's kind of like a hamster wheel. Um, it just never ends. But you're not just dealing with the illness, you're dealing with the way your nervous system deregulates and kind of short circuits when the symptoms aren't addressed. Um, Patients have said, I don't trust my judgment. I keep getting told, especially if you have a chronic illness, Crohn's disease, as with things that you need a lot of care for, and if you feel maybe embarrassed about it, or something's wrong with you, uh, you have an extra challenge maybe that other people have, but that doesn't mean something's wrong with you. And It might mean you have to work a little harder to support yourself and advocate for yourself. The autoimmune disorders, there's thyroid dysfunction, chronic fatigue. Well, we're all chronically fatigued. We're, you know, we're managing our households. We're going to 9 to 5 or other shift work. Shift work is the worst thing you can do for your health. Nurses do it all the time. Police officers, um, night shift, and actually shift work genders people that change different shifts, rotating. They usually have, it's been proven, a shorter lifespan. Um, Endometriosis, fibromyalgia. Uh, we tend to not want to share a lot of those personal, sexually related issues. Speaking of sexually related issues, the everybody should be aware of this, especially parents. The typical age group nowadays for the old STDs that back in the day maybe they thought it was the old soldiers coming back from war, and also HIV illnesses is between 15 and 25. We have a lot of advertising from the pharmaceutical companies. It tells you one pill and you're undetectable. Please, parents, educate yourself and educate your children. Um, Neurosyphilis is back and increasing every day in this population, at least in America. I can't speak for the rest of the world. Um, so educating yourself and your family is important. Um, Back in the day, my age, your parents didn't really want to talk about that. Even when it was time to start your monthly cycle, Kotex had a nice little book for your mother to give you, what to tell your daughter. It was a little kid, everything was in there. You know, I I went to college and my father wanted to say, well, there's going to be a lot of older men at college. And I didn't want to hear it. I said, oh, Dad, I know all about it. I didn't know anything. You learned the way everybody else did back then. But all of these things, viral syndromes, they can change. You might be feeling worse at different times of the month because hormones and your hydration, again, water is your cheapest medication, but it is not the cure if you have a chronic illness. It just helps the treatments for those chronic illnesses be more successful. So, a lot of conditions have normal labs in the beginning, a lot of autoimmune disorders, multiple sclerosis, CIDP, some of the others that we've talked about, Lyme disease. You often end up getting Crohn's disease. Even you end up getting misdiagnosed. It's not that your doctor's incompetent. It's that maybe we don't have the right blood tests. We're not listening to the patient carefully. Um, there are some patients that have some of these GI chronic autoimmune illnesses, and doctors say you can eat whatever you want. If it gets bad, we'll just do a colostomy. Well, that to me is not a good solution, not for me at least. Um, but it's why it's important to educate yourself and not be embarrassed to ask questions. And it's okay if the doctor's not listening to you at multiple tries, whatever. It's okay maybe to seek somebody else, but do your research. Um, you wouldn't get a lawyer typically from a placemat, but you can maybe there's support groups for the symptoms you're having. Maybe you can find people that know who the experts might be. And if you're dealing with an expert of what you think you might have, and be grateful if you don't have it, and they can usually tell you where to go next. We'll be right back for our next break, and we'll continue this discussion. Thank you.
Did you know that your beliefs create your entire reality, but it's the subconscious beliefs that do most of the creating? Belief shifter and life coach Shiraz can help you identify those limiting beliefs and eliminate them, often in a single session.
Like it was almost instant, like I had relief right away.
Creating better health, relationships, careers, and finances. Let Shiraz help you step out of safety and into awareness.
Definitely something's happening. It's like a flow inside. It feels good.
Whether in person or online, Shiraz provides personal coaching, belief shifting. Visit Shiraz at energeticmagic.com or call 416-529-7429. Energetic Magic. Find your greater happiness. Be well. Be aware. Be magical.
Are Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of the Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on the Caring Generation and PamelaDWilson.com.
Welcome back to the Holistic Nurse with Peggy Smith. We're discussing medical gaslighting. And in this section, I'll be talking about how to advocate clearly and calmly when you're trying to talk to your medical provider. Chances are you wouldn't be abnormal if it took you a while to get the courage to finally make the appointment. And some of the things we're going to be talking, if you have family members or this resonates with you, please subscribe, leave a review. And if there's particular unique situations you'd like to either privately email me or, ask a question on the YouTube site, I'm happy to get back to you. I do read everybody's replies. But education empowers you, and advocacy protects you. But true healing, requires a combination of both of those and a few other factors. Um, if you don't get the answer you need, you might feel angry or hurt, but lashing out and attacking the provider is usually not going to be helpful. I can't imagine any situation it would, but there are questions that you can ask uh, as you're trying to understand why maybe it's the doctor has his own communication issues. He's uncomfortable if he's going to be talking about something, that is hard to talk about. But you can ask, can you help me understand why my symptoms don't match the test results and the lab work? Uh, if you really feel strong that, that he's off base completely, you know, uh, you could say something like, well, what would you consider if this was very early stage? I mean, obviously you want something that's chronic or serious to be caught in the early stages. And you can say, is there a specialist that can recommend further testing so that, I feel a little more comfortable that, maybe this, always hurt, too much, an extra mind, extra set of eyes on something. A lot of times you see something that's you missed right in front of you. And if they're talking about, it's an inflammatory situation, don't judge yourself. Don't feel guilty that you're eating a lot of junk food or still smoking and you're having symptoms of lung cancer. Um, there are a lot of people that have lung cancer that have never smoked in their life, but there's lots of treatments. If things are caught early, the lifespan, life expectancy is getting longer and longer. There's lots of immunotherapies, a lot of chemotherapies that used to be just for one or a specific type of cancer. Research is now expanding that and finding a Keytruda, for instance, can be lung cancer, can be a whole bunch of different um, GI cancers also. And when the cancer's gone, it can help keep the cancer away. We have a lot of medications like that. Medical research is valid and should be supported. But you can say, what would you suggest if this was, is there things that you can control? You can control your diet. You can control making sure that you take any medications that are prescribed. And if you're taking a prescribed medication and you have side effects that, sometimes they joke the cure is worse than the disease. Um, the side effects are usually temporary. If you're put on a new blood pressure medicine and, don't quit because the first week you just feel totally exhausted or you just don't feel right. If it's something that you're only taking once a day instead of in the morning, the doctor might suggest you take it at bedtime. So the worst of the side effects, which are usually temporary, would be experienced while you're asleep and doesn't affect your activities during the day. It's important to keep a symptom journal when they start, what kind of activities you're doing, or what something that you've eaten when something starts. Um, if you know your family history, that is important. Medication and supplement list, those over the counter drugs. Don't be embarrassed. The doctor needs to know what you're taking. If you're on a blood thinner, you shouldn't be taking fish oils, for example. And they say fish oils, and it's true for some people, fish oils can help with depression, they help with circulation. But if you're already on a blood thinner and you have to go in for surgery and your doctor doesn't know you're on fish oils, vitamin, things like that, there can be problems in surgery. So it's very important to be honest. If you're using CBD products or other uh, if you're even using street drugs, you can be honest with your doctor. He's not a narc. He needs to know though, so that he doesn't prescribe something that has an adverse reaction for you. Um, and it's also important that as we get older, especially, to keep a medical history accessible. If there's an emergency and the paramedics come to your house, some people have it on the refrigerator or someplace the family member knows where it is. That is an important tool, because there may be a time that you can't actually remember to tell everybody this. Certainly have your allergies. If you're a diabetic, you should have some kind of medical alert, or paramedics know how to access your phone if you have that information in your phone. Um, so concise communication helps the provider be less overwhelmed, because he can get to answers quicker. He's got to go through the whole, if it's not this, it's this, that whole flow sheet. It's a lot quicker when he knows what the symptoms really are. So no matter how minor or silly you think your symptoms are, they're not in your head. They're real. Uh, Maybe they're not permanent, maybe they're not serious, but they're all part of a total picture. And medical providers, we are human. We are often pressured by the insurance companies. The documentation rules are strict. We have guidelines where if X, Y, and Z doesn't show up in the notes, insurance company's not going to pay for the visit. If the doctor doesn't list all of your ICD-9 codes, there might be things that you need that won't get covered, because the doctor will say, well, there's no history of this. Why do you need this inhaler? You're not even asthmatic, but you are an asthmatic. You had croup as a baby, continued your whole life. It just was never properly documented. Um, Insurance does influence chest testing options. There are certain tests, say the PSA test for men for prostate cancer. Insurance usually says you can't get that more often than once a year. Mammograms are usually covered by major insurances, and I learned the hard way. The basic screening is covered, but when you have maybe dense breasts or something they're not sure about, they want a second look. That's not covered. It's not free, at least the way the first one is. But if getting that paid for is a problem, there are resources at the hospital. You should never skip a follow-up test because of insurance reasons. There is a department in the hospital, a patient advocate. There are services available. They have funds available for people that don't have insurance. Um, they will send you home with prescriptions filled at the hospital. Most hospitals, if you don't have prescription insurance outside the hospital, there's always options, and they'll get you a patient advocate, especially if something turns out to be serious. Um, there's a lot of community support, that you'll have a home care nurse perhaps, or physical therapy. There's a lot of serious medical problems that can be avoided major surgery by getting physical therapy. That's often overlooked. It used to be considered almost holistic. It's certainly holistic in the sense that it helps the total picture, but it can save you lots of money and pain and, recovery time. Uh, Regenerative medicine is often another option, which more and more is being covered by medicine. Um, and it's not every symptom is catastrophic, although it might feel at the moment you're feeling it catastrophic. Uh, and not every provider is really ignoring you. They just might have a lot of things on their mind, or they know that they can't order the tests, as many tests as they would like to get right to the heart of it, and they can't order the higher level testing until they've done the lower leveling and proved that they need the higher leveling. Uh, and not every normal lab is wrong. It might just be maybe you didn't eat that day when you were supposed to eat, or it was supposed to be fasting and you didn't fast before you got it, so the results are not accurate. There might be certain times of the month that your blood count is lower than usual. Um, Depends on what you ate, maybe the previous week, that can affect lab tests. Uh, but you do deserve to be heard. Um, and when you feel that you're not, take a deep breath and kind of regroup. It's better if you have your notes with you. You can kind of, you know, make it less personal by going, okay, doc, the next thing on my list is this. Keep records, keep breathing, and you need to seek second opinions when, if you absolutely can't get anywhere. It's okay, and it's, more than just recommended. You need to get a second opinion, um, because we're human too. Um, but nobody's here just to, I mean, if everybody doesn't survive our care, then we're out of business too. We need to have people, to do what we do. But advocating yourself is not confronting. It shouldn't be done in an argumentative way. It's a teamwork process. You're just as important on the medical team as all of the consulting doctors. Um, and your body is very adaptable, very resilient, a lot more resilient than we think it is until we've on the other side of a crisis. Um, your mind is extremely strong, and it coordinates everything that's going on in your mind. So you absolutely can get the help you need, and without starting a major war. Um, they say the squeaky wheel gets the oil. It's not quite like that here in healthcare, but all of the practitioners, it's not easy to go into this field. Nobody went into it for glamour. Um, Everybody started in the basic training. We learned how to make beds and empty bedpans and things like that. And we learned how to talk to people and listen to, even more important, we learned how to listen to people. But, it's a skill that has to be practiced. Maybe a younger, newer practitioner hasn't finessed that skill yet. Um, but you're valid. Your feelings are valid. Your symptoms are valid, and you deserve to be heard. And you're entitled to have the right health care. Um, Typically, holistic options are not curative by themselves. I say that they should be used alongside. When I had a serious medical issue, the East and the West work together, and you have better outcomes. And you have better outcomes if you're part of the team and talking honestly with your doctor. Um, the doctors are trained now. If you're in an abusive situation, you can trust the doctor. He can put you in touch with resources. That's a common problem that's missed a lot of times when you're dealing with personal stress at home. And you're embarrassed that it's almost a dangerous situation. It might even be dangerous. It's not your fault. Nobody deserves to be abused, and you need to open up and trust your medical providers. So we will be right back after our final break, and I hope this information is helpful. It gives you some things to organize your thoughts for your own care. We'll be right back. Thank you.
Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness: Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals. Did you know that your beliefs create your entire reality, but it's the subconscious beliefs that do most of the creating? Belief shifter and life coach Shiraz can help you identify those limiting beliefs and eliminate them, often in a single session.
Like it was almost instant, like I had relief right away.
Creating better health, relationships, careers, and finances. Let Shiraz help you step out of safety and into awareness.
Definitely something's happening. It's like a flow inside. It feels good.
Whether in person or online, Shiraz provides personal coaching, belief shifting. Visit Shiraz at energeticmagic.com or call 416-529-7429. Energetic Magic. Find your greater happiness. Be well. Be aware. Be magical.
Welcome back, everybody, to our final segment of medical gaslighting. I want to take a minute to compare this to a situation outside of healthcare that might be more relatable. My career before I was in nursing was special education, and I had one of my children required some special services at school. And that's kind of another environment that sometimes parents are very frustrated. It's hard, in your gut, that maybe a child needs something that is not going to be provided for in the regular routine school activities. Um, I had a couple children that I'm grateful for were on the higher, the like advanced placement type part of the spectrum. And then I had a child who needed extra help and support. I knew that he needed extra help and support. I wanted him to be held back a year, going from kindergarten to first grade because of when his birthday was. And starting with my pediatrician, he used to say to me, your first two children were gifted. This is just a normal child. Relax. You don't know what a normal child's like. And I know what it's like to, my gut kept saying, no, I'm going to have to fight for this kid the rest of his life almost. And I had to join organizations like Parents Involved Network, and I had to go to the school and say, all right, if you're not going to hold him back like I think he needs to be, then we need to talk about getting an individualized education plan, getting him tested so that you have the documentation. That kind of testing is just like getting your lab tests and your X-rays and the things you need for medical problems. Um, and you wouldn't hesitate twice to advocate for your child. You've got to advocate yourself with the same tenacity and energy. They to get the extra help he needed in school. The system was built in such a way that you actually have to fail at lesser restrictive ways of helping him. I knew he needed the they call it a TSS in our area, like the extra support person to go to school with him to kind of keep him on track, to manage some of his anxiety episodes and things. And in order to get that, I had to first let him experience the negative experiences of failure. And it was very frustrating. And healthcare is very similar to that. It's important that self advocacy is not confronting, it's just listening to your gut. And doesn't mean you might not be always right, but at least you'll get relieved to know that it's okay to be wrong, especially if it means that you're healthier than you were worried about being. It's human to right away jump to the worst conclusions. That's just what humans do. But your body is very adaptive. Healing requires a partnership not only with the practitioners, but with your body and mind. Um, you know, you have to stop dismissing what your gut is telling you, and you have to listen to your mind when they're helping you cope with some, stressful situations. But between the patient and provider, and between science and life, and between mind and body, it all works together, and it has the best outcomes if everybody pretty much can communicate. You might not be on the same page, but at least everybody knows where everybody stands. As a nurse, just like doctors, we do no harm. We advocate for the patients when they can't advocate for themselves. And in this series, I try to empower my guests and viewers on the show to know that, you don't need a formal medical education to advocate for yourself. You just need to trust your gut and your mind, your heart, um, and your instinct. Your instincts. If you're really thinking the worst and your instincts were wrong, well, that's a blessing. You can be grateful, but also be grateful for your instincts that are helping you get the care that you need, and don't give up fighting for what you need. You have a right to be healthy. You have a right to feel good. Um, you know, People that had no mental health challenges, by the time you're arguing with or trying to find the right practitioner, you're going to feel like you're having major mental health challenges, and you are by definition. And that's okay. Those are normal experiences, normal feelings, but you still need to keep your feet on the ground, stay grounded, you know, do whatever it takes, keep referring to list, write things down so you don't panic when you're at the doctor's and forget to say, I forgot to tell you, I'm going to the bathroom now 10 times a day, and I don't think that's normal, is it? Um, there's nothing the doctors haven't heard. Um, if you're having an intimacy problem that's physiologically affecting your relationship with your partners, uh, you need to talk to the doctors because sometimes they're simple and there's even holistic options to help get beyond those things. But it's okay and feel good if your doctor wants to rule out physiological problems because it could be a physiological problem. Uh, Same thing with fertility. You're not broken if things aren't working the way you would like it to. You always have options, and it's usually a combination of holistic, alternative, and traditional medicine. But traditional medicine is one that's going to give you the testing and the scientific justification for going further for the care you need. And if your insurance does not approve something and you know you absolutely need it, it's life-saving treatment, please appeal. Same thing with medications. Um, there's always options for medications. Most pharmaceutical companies have programs for people that can't pay the copay. They want to promote their drugs because they want to continue the research so they can tell how effective these drugs are. Um, so you're not saving money if you skip medication because you think you can't afford it. There are services and options available. And if you tell your doctor, the nurse of the doctors, that you can't afford it, he can find a less expensive maybe, or he can get you on a program that pays for it. Because skipping necessary medications is not a healthy option. And it's not embarrassing to say you can't afford medication. Medication is really skyrocketed in price. So thank you for joining me today on the show about gaslighting. If anybody has any questions, privately you want to reach out to me. I hope you learned something and you feel more empowered. Um, and, please don't discount your own feelings. Fight for yourself, fight for your family, your kids, and do it in a professional way, regardless of your education level. If you have cultural concerns about your situation, let the doctors know. And everybody have a great week. We'll be back next week. Thank you for joining me. And please remember to subscribe and like and share. We have more informative shows coming up. It's been a pleasure to talk to you today. Take care and stay healthy.
This has been The Holistic Nurse with host Peggy Smith. Tune in each week where you're encouraged to send in questions and receive private responses and suggestions if appropriate. Thursdays, 1 p.m. Eastern.